Hello everyone, good afternoon. Thank you for joining me today. My name is Clay Goddard. I'm the Director of the Springfield-Greene County Health Department. It's been a little over a month since Greene County experienced our first confirmed case of COVID-19. In that time, we have had 80 confirmed cases in our community, 38 people have recovered, and 8 have tragically died. We learned a lot in this month, and it seems like an incredibly short period of time, and at other times like a lifetime. We've learned more and more about this illness. We've learned how to use technology to stay emotionally connected while we have to physically distance ourselves from one another. And we've learned what our community is capable of when we all come together around a shared goal. I am exceedingly proud that our community was proactive before we ever saw a confirmed case of COVID-19, and that we were aggressive when we began to see that this disease had arrived in our community. Throughout this month, I've talked about the 3 pillars of our community response. One of these pillars is testing. To date, we have tested more than 1,500 people through our local mobile test site, which is a great collaborative effort between our healthcare partners. In total, we believe that there have been nearly 2,400 tests for COVID-19 conducted in Greene County. But we know that in this past month, testing has been limited, and that there have been people who have sought testing who did not qualify for that testing that they desire. In recent weeks, our community has worked hard to expand access to testing through the addition of partners like Dynamic DNA. This has us feeling confident in our ability to test people who need to be tested for this condition. And this week, our healthcare partners have come together to collectively relax the previous restrictions on testing so that we can further expand our understanding of the spread of COVID-19 in our area. Those who are experiencing symptoms like a cough, fever, or shortness of breath should be in contact with their healthcare provider if they believe that they need COVID testing immediately. Expanding testing capacity in our community will be an important part of our strategy moving forward as we look to what's next. We have to be looking at data and science to inform our next steps in containing this disease. I'd also like to address the conversations I'm hearing out in the world that we have flattened the curve or that we've hit a plateau as a community, and what that means as to whether we should return to life as normal. I am very much encouraged that our numbers seem to be moving in the right direction. But this isn't the time to declare mission accomplished. We have to remain vigilant. We have to be taking precautions for our health, and we have to stay the course. We are currently in a phase of this response where we are influencing the virus, ignoring the practices that got us to this encouraging moment only puts us at risk of going right back to where we started as a community. This means continuing to stay at home and finding the right phased-out approach to coming out of these orders. We must continue to control the disease as we strategically work toward our next phase of this response. And we must do that by using data to inform our decisions. The second pillar of our COVID-19 response is containment. That is knowing who is sick and keeping them away from folks who are well. I want you to know that the things you are doing do make a difference. Things like washing hands, practicing respiratory etiquette, and most importantly, staying at home as much as possible. This is what has helped us to contain and control the spread of this disease, and continuing to practice these proven techniques will be oh so important to our community. Cloth face coverings are another tool, but let me be clear about a few things. They are A, not to be used in place of other containment measures, and B, must be used correctly to be helpful, or I fear that they could actually be hurtful. This weekend, I briefly went to 2 stores to pick up a few essential items for my wife and I. I decided to count the number of people I saw improperly wearing face coverings. In less than 30 minutes I spent in 2 stores, I noticed 15 people who weren't properly using them. This including taking the mask on and off, touching the mask repeatedly, or not wearing the covering over both the mouth and nose. I also noticed that people who were wearing face covering didn't seem to be taking the same 6-foot distancing precautions as we've recommended. In fact, several people got in my personal bubble, which I didn't really appreciate. So using the mask as a replacement for those distancing guidelines is never appropriate. In those cases, I worry that a cloth face covering has given people a false sense of security. If used improperly, these not only aren't providing good protection, but they could potentially be putting the wearer and those around them at higher risk. Facial covering is only a part of a toolkit, and cloth face coverings are for essential trips for needed services or items, not an excuse to get out of the house. I would also repeat again that the cloth face coverings are not surgical masks or N95 masks. Those are critical supplies that must be reserved for healthcare workers and other medical first responders. Our third pillar of COVID-19 response is disease mitigation. This mitigation phase is largely focused on the stay-at-home orders that the city and county have implemented. The fuel that this virus needs is people being physically close to one another. We have been and must continue to take the fuel away from the fire, and we believe we have. Churches are continuing to make tough decisions, especially this last weekend when many of us wanted to get together like we traditionally have in the past. Businesses have stepped up. Even before the restrictions on retail occupancy were put in place, they put in place physical distancing standards in many of our local retail outlets. Restaurants have adapted rapidly to a whole new business model with curbside pickup or drive-through options. And I've mentioned before that public health practice is a little science intermingled with a little art. This week, we are and will continue to meet with community leaders across a variety of sectors as we look to build a strategy for the next phase of our community's response and recovery from COVID-19. As we prepare for moving into a recovery phase, we recognize that we must have good data to drive our decision-making. We also recognize that while it is vital to have the ultimate regard for maintaining life and reducing the spread of illness in our community, it is also very important to get our local economy moving again. These and many other considerations will be a part of how we map the path forward. And while I don't have specific metrics or plans to announce today, we will absolutely be sharing more in the near future as this plan comes together and crystallizes. With that, I'll turn the mic over to Cora Scott for an update.
Thank you, Clay, and good afternoon. We would like to take a few moments to thank several people and organizations who stepped up to volunteer and collaborate over the past weekend in order to get emergency overnight warming centers set up and running this Sunday evening as temperatures became unseasonably cold and dangerous for our unsheltered friends and neighbors sleeping outside. The city relies on assistance from Community Partnership of the Ozarks Alliance to End Homelessness, and area churches and nonprofits in this endeavor. The pandemic has brought several new challenges, including the need to find alternate ways to provide shelter that provide both screening and physical distancing. This past weekend, when the forecast called for temperatures to suddenly drop below freezing, the city worked with the Alliance and the Springfield-Greene County Office of Emergency Management to stand up 5 cold weather shelters. It could not have been done quickly enough if it were not for the hard work of Janet Dankert and the team at CPO, Larry Woods at OEM, Wade Drossel, the city's Building and Development Services Director, Fire Chief David Pennington, and several kind-hearted and quick-thinking individuals and organizations. The city and Greene County have relied on CPO and the partners on Philanthropy Row, Greg Burris and the United Way of the Ozarks, and Brian Fogel and the Community Foundation of the Ozarks in a number of ways, including helping us convene the faith community in an initiative we call Have Faith. Benevolent organizations and churches representing a variety of faith traditions meet with us weekly to collaborate. Many of these organizations were instrumental in ensuring that church services were virtual rather than in person, which, according to Health Director Goddard, helped prevent the spread of COVID-19. Membership from Have Faith, including co-chairs Mark Struckoff and Bob Roberts of Second Baptist Church, mobilized to open and staff the 5 cold weather shelters throughout Sunday evening, Easter evening, and will do so again this evening. Our sincere thanks go out again to Janet Dankert and CPO team, Christy Love and the Connecting Grounds Church, Phil Snyder and Brentwood Christian Church, Jen Simmons, National Avenue Christian Church, Erica Harris and Barbie Pohl with the venues, and David Kendrick at St. John's Episcopal Church. We appreciate the support also of Springfield Public Schools for the use of Doling Elementary, Associated Wholesale Grocers, who emergency provided food over the weekend, United Way of the Ozarks and OEM for supplies, Elisa Coonrod and Mercy for providing healthcare professionals on site, and the many, many others, including the Gathering Friends, homeless advocates who are volunteering to spend the night in these shelters and are providing transportation and assistance. The Ozarks Alliance to End Homelessness and the Coronavirus Task Force will host a Facebook Live on Thursday to provide additional information about assistance for the homeless, including ways you can get involved in that effort. But we sincerely wanted to thank the literally dozens of people that got involved over the weekend to help us with this. It really does show our collaboration in Springfield and Greene County. So thank you. And now we'll go to questions. From Jesse Inman at Color 10. The state order ends on April 24th. The Greene County order ends on April 25th. Will Springfield Greene County extend its order that ends on April 25th? What will that decision be based on? And if the order is lifted on time, will it go straight back to normal, or will it be a slow rollout for certain businesses and activities? I believe that Clay answered that question, that discussions are underway right now, and we will be able to provide more details in the coming days. But it will not be an automatic flip the switch, everything's back open again. Also from Colin Lingo. Can you reiterate the number of cases in Springfield, Greene County area? Was that 80 or 88 cases?
I'm sorry, I probably didn't enunciate very well. It's 80 cases.
Do you know how many of those, Clay, were required hospitalization?
I believe that 8 are currently hospitalized. I don't know how many of the 80 required it, but 8 are currently hospitalized.
Colin, we will find out the details of the numbers if we can and get those to you. From Katie Cole at the News Leader. Clay, can you collaborate a bit on how local healthcare providers have been able to expand testing capacity? Obviously, the Dynamic DNA partnership is a part of that, but are there any other ways local providers have been able to get more supplies?
So good question, and yes, Dynamic DNA is a big part of that. There's also a lab up in Columbia that we've been able to leverage testing supplies from. I believe it's called Gene Trait in Columbia, and I believe that we've still relied a little bit on Quest, but remember, I said very early on that the testing issue would resolve itself. I think we're headed that direction, and we've got multiple avenues that we're traveling to develop in-house capacities in multiple organizations in the city. So that picture will hopefully get a little better as we move forward in the next several weeks.
Some follow-up from Katie Cole at the News Leader. Can you say specifically how testing requirements may have changed? Do people not need to have a fever now? Will people who are asymptomatic and may have been exposed be tested?
So the previous criteria at the mobile test site required that there be multiple symptoms, such, for example, a cough and a fever. We've relaxed that now so that only one symptom needs to be exhibited to be qualified for that testing. I want to clarify, though, it does not mean that you don't have to have that doctor referral. That's still a requirement. And one other thing that I would like to throw out there, people should not show up at Dynamic DNA's offices and expect to get tested there, because I've heard reports that people are actually showing up there thinking they can get tested there. You have to contact a physician, get a referral, and then you'll be directed to the mobile test site.
Clay, can you explain specifically how better data will help inform our next steps in recovery?
So if you'll recall, going backwards a month, we were really flying blind. We had no testing. When we were able to leverage testing, it was taking 2 weeks to get a reply back with the result. So now we have, the vast majority of our tests take less than 72 hours. Many of them can be less than 24 in many cases. So that data is a huge advantage to us as a community in doing our containment strategies. We're never going to get rid of containment. Those are quarantine and isolation orders. That's a critical piece, and actually I think that played a large part in keeping our numbers low in this community. So by being able to identify cases early and then being able to quarantine all of the contacts to those cases, that's really a game changer for the community, because you can take the fuel away from the virus that way.
Will Greene County be introducing serological testing to detect antibodies of coronavirus?
Yes, you can anticipate serology studies and seroprevalence studies probably nationwide. I know that those test kits, they're very simple. It takes a finger stick, almost like a blood sugar test. Those tests are coming out of manufacturing right now. I would anticipate they'll be widely available here in the summer at some point. We will probably focus our testing initially on frontline health care and first responders, but then there will be great interest in knowing what the seroprevalence is in the entire community. So that's going to be something that continues to unfold, and we'll know more certainly within 30 days.
Just a follow-up to Colin Lingo's question, Catherine Wall texted, and there's been a total of 21 people who have been hospitalized as a result of the coronavirus. That's all we have for this briefing. I remind people that we will have a live town hall simulcast on KY3 and Color 10 this evening from 6:30 to 7. Clay Goddard, as well as Dr. Robin Trotman from Cox and Brent Hubbard from Mercy will be joining us this evening, as well as Police Chief Paul Williams, Janet Dakert from CPO, and CJ Davis from Burrell Behavioral Health Center.